So my group consisted of me and Ginger, and our program is called FED, which stands for Fighting Eating Disorders.
Why FED is needed. Anorexia nervosa has the highest rate of death among all psychiatric diseases. Anorexia nervosa is a type of eating disorder that is characterized by abnormally low body weight, intense fear of gaining weight, and distorted perception of weight. Mental health illnesses are a common problem in America, with the highest percentage being 30.6% between the ages of 18 and 25. Before this, though, 95% of individuals with an eating disorder are between the ages of 12 and 25. Eating disorders co-occur with depression, anxiety, and poor body image, meaning it is a mental health problem as well. Services of the past have not included mental health aspects in schooling, and the services that are also limited for students who cannot make money or low income in the first place. That's why there's a 1 out of 10 only get treatment that they need. The costs also are $500 to $2,000 a day for treatment, which is very undoable for a student. The benefits of having a mental health uh, service in a school is better education and better grades. The purpose of FED is to reduce the amount of eating disorders and to reduce the amount of mental health disorders. We are targeting this by improving the self-esteem and body image, which in turn improves overall quality of life. By doing this, we are providing access to mental health aid with our partner, SimplePractice.com.
The FED plan consists of an environmental change as well as health education. Prior to the start of the FED program, we will set up various social media, including Instagram, Twitter, and TikTok. Uh, Additionally, we'll have paid promotions on those social media, which will spread the FED program to more people. After that, we'll post promotional flyers around the schools, which have information regarding the dates, the times, and a QR code to be scanned, which leads to our website, which will give full access to all of our social media and access to simplepractice.com and additional resources. Uh, at the start, we're going to start tracking the usage of our social media, so tracking the activity on our social media and as well as the activity of simplepractice.com. This is an example of the flyer. For our health education, we'll have different types of health professionals looking over our curriculum, like nutritionists and psychiatrists, to make sure that our facts are straight. We're going to visit the schools over a 3-month period, 3 separate times. The first time we visit, we're going to discuss eating disorders, um, their predisposing factors, signs, symptoms, and negative health effects. The second time we visit the schools, students will learn about general nutrition and health, as well as normal body proportions, distribution of fat, and healthy social media use. The last time we visit the schools, um, students will learn about the importance of positive self-esteem and body image, as well as how poor mental health can negatively affect their self-esteem and their self-image and their physical health. At the end of these educational sessions, um, we'll have short activities just to gauge what they've learned. Some of these activities will include word searches for time, Kahoot for prizes, and a craft. The prizes are important because they'll incentivize the students to participate and actually try to show what they've learned, therefore giving us better feedback. For our program, we are partnering with simplepractice.com to get more students access to mental health services. Students will have access to free therapy for 3 months, and after that, $20 a month for the rest of the year. We'll be able to do this through the grants that we receive and through our partnership with Simple Practice. Um, Simple Practice is really useful because it offers access to eating disorder specialists, dietitians, mental health professionals, and more. This partnership is important because it will be an environmental change that gives the youth access to specific help they need. For our program, we decided to use the theory of planned behavior to kind of explain how our program is going to change the behavior of these students. Um, the attitude towards the behavior by educating them on how these behaviors can physically affect them and mentally affect them will hopefully change their behavioral beliefs. The subjective norm mostly stems from social media use, the poor use of social media, and how it can exacerbate mental health disorders. Um, and by providing an environmental change through simple practice, we're also kind of changing their perceived behavioral control by kind of giving them, more access, easier access to the help they need.
Marketing. Our product is the program itself, FED. It is a health promotion program that aims to reduce eating disorders in young adults, focusing on freshmen and sophomores in high school specifically. FED is designed to inform students that are at a susceptible age of eating disorders and to bring accessibility to dietary and mental health services at an affordable cost for a student. The place this program is taking place is in Oklahoma City Public High Schools. With our partner SimplePractice.com, the price point is the first 3 months free and $20 a month after until they graduate. Our program is also having free educational sessions throughout the first semester during freshman year. The promotional aspect is going to start on the first day of school with teachers introducing the QR code and a little brief overview of what FED stands for and what it is. Then, 2 weeks before our promotional campaign comes, or educational sessions, there will be the flyers, which also have the QR code to our entire website that has every resource about eating disorders. During the informational sessions, they will have continuous health communication and education with info. Within there is stickers, t-shirts, and other incentives for prizes to keep engagement. On social media will also be another promotional tool because we will have relevant content that teenagers will find engaging on TikTok, Instagram, and Twitter. Plan for program launch/implementation. Adoption. To initiate the program, there will be a meeting with each Oklahoma City Public High School board to discuss a brief overview of what the program is entailing, days set to do program, and relaying that information to teachers to introduce the program in the first week of classes, as that is the first exposure for the students and the FED program. Tasks to be completed. This program will run for a total of 2 semesters, but freshman year is the main focus and information being taught, while sophomore year is more reinforcement to the program. The program will have more tasks needed to be completed before the program starts, and only some as the program is going. For FED to operate smoothly, the program planners will keep the intervention on track and organized. Some of the tasks to be completed are to hire and train facilitators, to create a pilot test program, revise program based on pilot, prepare for program kickoff, and full implementation, evaluate program, and write final report. Establishing a system of management. Since the program has many moving parts, it needs to have a variety of professional personnel on the board. There is a dietitian to make sure that nutrition information is being correctly conveyed and that the program covers proper nutritional needs for teenagers. The second professional on the board is a psychiatrist to evaluate mental health practices being taught. A school board member also needs to be involved in FED's program to make sure it is allowed in the high schools and is following the school's handbooks and guidelines. To keep the timeline on track, organize meetings, and put together all the varying parts of the program, A program planner is needed to manage the board. Lastly, a student representative from Oklahoma City Public Schools to ensure that the priority population has a voice in the process of the program built to help them and their feedback in what the program needs to address. Launch/putting the plan into action. A pilot test will be conducted for FED to ensure that the program is producing satisfactory results and operates accordingly. The pilot test of the FED program will take place with a randomized selection of volunteer students from Oklahoma City. The test will start in March of 2022, be reevaluated 5 months later with an email about self-esteem, and then evaluated the second time in March of 2023, a year after the initial information sessions to correlate to the second part, which will be sophomore year, of the FED program. During the pilot test, the program planner will take the feedback from the professionals teaching the sessions and the pilot practice students to decipher what aspects need to be adjusted for the real program to start, such as self-esteem measure, before and after, remembrance of signs and strategies, and post-information session activities being engaging. The program planner will then check if the marketing strategies used were useful to priority population and rememberable. After pilot test concludes, the board will then decide what needs to be changed to improve the intervention. The real program start will then begin the following fall of 2023. Ending or sustaining the program. A year after the initial program startup, there will be an evaluation in the form of seeing if our percentage goal was met in students using the online resources and improved self-image. If the goals and objectives were not met, then our program planners will adjust the curriculum being taught to better fit the students' needs. And if it does not continue another year, this program will end. This is our team that was advertised in the last slide. This is the project plan layout. It is pretty long, so it's because it takes a couple years. So there's the first half and the second half as seen.
Our evaluation will start with the process evaluation, where we will make sure that all the flyers about the FED program are posted all around the schools prior to visiting them. As the program starts, we will monitor our social media activity and see how many students are reading the FED flyers and scanning our QR code. Worksheets will be used in class to see if students are retaining the information they learned during the class. We will also use short questionnaires as a baseline to evaluate if students gained a better self-image from the classes later on. The number of students accessing and using Simple Practice will also be monitored so that we can see if more students are using the resource. We will also use Simple Practice as an impact evaluation. If more students are using the outside resource during and after the program, it will be good evidence that there's an important resource, that it is an important resource that the students need. Higher rates of using this resource will prove that more students are getting mental health aid, which we can assume will have a positive effect on their mental, physical health and stop them from developing a serious eating disorder. The main focus of the FED program is to increase positive self-image and self-esteem to fight eating disorders at the source, as well as provide mental health services to those who need it. Questionnaires will be used to see if students retain knowledge from the course and to see if their self-image has increased from their baseline. These short questionnaires will be used before the program starts, immediately following the program, 6 months after the end of the program, and a year after the program. Since eating disorders are a very long process of physical and mental health decline, it will be hard to get data on the students regarding any diseases they develop or if there are any fatalities. These questionnaires will help us understand if we are having an impact on the overall well-being and quality of life of the students. This information will also allow us to gain insight on what subjects we should focus on more or less in the future. This is a list of our references.
That concludes it.
Yeah.
Bye, Dr. Bracken.
Thank you.